Hello, everyone. Welcome in to our traditional live Q&A. I hope you hear me okay and you see me okay. Nice to see some familiar faces and names. Hi, Christine. Hi, and I see some new names. Very nice to meet you. Hi, welcome.
Thanks. I'm Jeff. Thanks for the invitation.
Sure, my pleasure, Jeff. Welcome. We're going to talk, we're going to have a little bit of a formal presentation today on food sensitivities, the issue that is very, very common in my patient's population. And we're basically looking for it, and we find it in a lot of our clients, especially the ones that are experiencing some autoimmunity, and how some of my teachers said, if we live long enough, we actually all end up with autoimmune processes. So it's good to know where it's coming from and the relationship with autoimmunity and the gut and food sensitivity, and how can we live healthier and protect our gut and our immune system from this exposure that will cause their food sensitivity. Hi, Selma. Nice to see you. Okay. All right, so I think people will be trickling in, and we'll see more and more people, but if anyone has an urgent question to ask me before, I know that there's some people who are new, and maybe you don't want to stay for the whole presentation and then ask questions. Go ahead, it's your moment, so you can just unmute yourself and ask me a question.
Well,
yeah, go ahead, John.
Oh, was somebody going to go first?
No, you go ahead.
Oh, okay. Well, I'm not sure, right, how this works, right? But the reason, right, I came here was I have high cholesterol and some problems, right, that I won't go into as a result of that. So, I want to try to do what I see a nutritionist. Any ideas, right, about what things could help? So that's why I primarily come. So I'll let you take over.
I see. Well, definitely you would need to be evaluated to answer questions, because there's so many different reasons for cholesterol to be elevated, and to understand is your cholesterol doing damage, or is it just rebuilding your brain and your testosterone and your cellular membrane? That's where we use cholesterol most of the time. So not every high cholesterol is the problematic. And even if the problems happen, how can we prevent more problems, right? That's secondary prevention. So looking at the genetics, that's what we do in our practice. We're looking very precisely into the genetics and identifying the vulnerable pathway for our patients, teaching our clients how to, what to do, how to change lifestyle, what to eat, and what not to eat, most importantly, and what to drink and what not to drink, right? And what supplements to take to protect ourselves from high cholesterol. And other vulnerable pathways in the genetics. So that's what we do after a very customized evaluation that people go through in our practice. Yeah, you're muted, Jeff. So if you, and I think someone else. Mm-hmm.
No, I said thanks. I'm going to listen. Yeah, and then
Yeah.
Good.
Yeah, food has a lot to do with what happens to our cholesterol, right? And not only in the quantity but also quality. So that's why we start with food as medicine. I see a lot of new and familiar faces, which is great. It's nice. Sorry for their sirens. We're in the Midtown, New York City. So it's a true life presentation. So anyone else has a quick question before people are trickling in? I actually like to live by, you know how in New York, the Broadway theaters, they all start at 5 minutes after the hour. So I'm giving people an opportunity to come and join us. Any other questions?
Can you still hear it?
Yes. Hi, Leonore.
Okay, it's fine. I will.
Hello.
I'll just close my door.
All right, so it looks like Eleanor wanted to ask something, but then she changed her mind, which is fine. So we're gonna start with my presentation. And please let me know if you see my slides. You can just type on mute and tell me that, yep, we see you.
Yes.
Great, thank you. And you'll see my slides to be moving forward, right? So let me know if there's any technical problems. You can feel free to interrupt for that reason anytime. So today we're going to talk about a very important topic in functional medicine, topic of food sensitivity, food sensitivities that are becoming more and more prevalent in our population. It's something that could become a problem not only to autoimmune condition, but many other age-related condition or inflammatory condition that we are dealing with as life goes on. So for those of you who don't know me, I'm Dr. Elena Klemenko. I'm a functional medicine internist in Midtown Manhattan. And for those who don't know what functional medicine is, it's a medicine that looks at the root cause of chronic medical condition. With functional medicine, we have an opportunity to stabilize and sometimes reverse medical illnesses, and that's why we are here today, and that's why I love to practice this kind of medicine more than just symptoms-driven internal medicine that I originally learned in American medical system. So more people are coming in. I'm telling you, New Yorkers all come 5 minutes after. So welcome, welcome. So today we'll talk about food sensitivities and how it affects our autoimmunity. So this is kind of our expectations. What are we going to talk about? We're going to talk about what are the food sensitivities, how is our gut being their main connector to our immune system, how we do the food sensitivity testings and what are the mistakes to interpret those food sensitivity testing, what are the treatment options for the food sensitivity, and I'm going to say a few words about their Immune Foundation program. So as I progress my slides, you should see the change of the slides, so you let me know if you don't. And you probably know that 70% of our immune cells live in our gut. This is how important it is to keep our gastrointestinal tract, our stomach, our small intestine, large intestine, our liver, all of those gastrointestinal conglomerate of the organs is the number one step to the healthy immunity. And that's why we are talking about it today. And of course, food, of course, plays a huge role in keeping our immune system strong, not only because it delivers nutrients necessary for the immune system to function properly, but also because when we develop food sensitivities or allergies, actually distracts our immune system and makes our immune system somewhat antagonistic to our health, especially in the cases of autoimmune processes. So let's define the difference between food sensitivities and food allergies. So food sensitivities are usually much more common. All of us will experience some sort of food sensitivities throughout their life. They kind of come and go, and the reactions to food sensitivities could be delayed up to 3 days. They are not necessarily develop right away, and you might not see the reaction or symptoms immediately. And they usually are signs of the leaky gut. And we're going to talk about leaky gut or increased intestinal permeability. That is a scientific term that when you speak with your conventional doctors or gastroenterologists, they will, cross you by your saying something wrong. But if you talk to them about increased intestinal permeability, they totally will understand what you're saying. And the food allergies, of course, are becoming more and more common. They're much more immediate. Sometimes they're life-threatening reactions that can develop, and we see more and more children developing those problems, but also adults as well. So what are the food sensitivities? So they're detected usually by finding the antibodies in your blood, or even in the stool, that to the food particles. So you eat some particular food, that food is actually stimulates your immune system develops antibodies against that food, and that will create food sensitivity. So this usually happens when the integrity of your intestinal lining is compromised, and the food that you eat start now, it crosses the barrier, the gastrointestinal barrier, and it ends up in your bloodstream. And it should not be there. It should not be in that entirety, that in the sequence of the proteins in the food should not be appearing in your bloodstream, because that will stimulate your immune system, because immune system recognizes it as a foreigner and as a foe, and it will produce antibodies against that food particles, because those are the food particles is usually is a sequence of certain protein. And since immune system doesn't recognize it as a self, it will develop antibodies against that food. And next time you eat that food, there's already antibodies that will clump the piece of food in your bloodstream, and that will create a complex, immune complex, right? Antigen of the food, antibody that your immune system creates. And that complex, sometimes those complexes have a tendency to clump together. And those clumps are floating around the body. Sometimes they land in the blood vessels, creating the inflammatory reaction. Sometimes it can even go through their blood vessel and create problems in the joints. So those immune complexes related to food sensitivity create a lot of inflammatory response in our body. And those are the common symptoms of food sensitivities. We see them not only in their gastrointestinal level in the form of stomach pain or nausea or upset stomach, but also in the form of their other tissue presentations like rashes, a lot of eczema or atopic dermatitis or some other skin presentation or rashes can be related to the food sensitivities. And those complexes that I just described to you commonly become a reason for autoimmune condition. But most importantly, those complexes are extremely inflammatory. And wherever they land, could be in the brain, that will cause the brain fog, or it could be in the joints, and it could be the joint pains and the joint deformities. So that's why we want to keep those food sensitivities low. All right, and I would like to just jump into their case study to show you how the food sensitivity and resolution of those food sensitivity can affect our clinical outcomes. And this is the case of Regina, and Regina is my patient for a few years, and she is a 40 years old female with the diagnosis of the Hashimoto thyroiditis, which is the autoimmune thyroid condition. She came by already with that diagnosis, and she was trying to get the root cause of her illness because she's already taken levothyroxine, and then she was told by her primary care doctor that there's no cure for her condition, and if she has symptoms, she just needs to increase her thyroid hormone dose, and that would be the entire help that they can provide her or offer her. So she presents with the concerns of their progressive fatigue. In spite of taking her medication, she's still tired, and she has a really hard time to lose weight. Plus, she started getting these progressive symptoms of feeling very cold. So she became very much cold sensitive. She developed this progressive afternoon fatigue. Plus, she started losing her hair, and their nails become brittle. Those are all, and she's very constipated, by the way. So she is expressing the symptoms of low thyroid in spite of taking the medications. She tried to lose weight by cutting her calories, but it really didn't help her much. And she continues to eat our typical standard American diet, which we call standard American diet SAD. That's what I call it. So she got really constipated, and now she has bowel movements only twice a week, which is always a problem, right? Because we need that evacuation process. We need to have a regular bowel movements in order to detoxify properly. If we don't move our bowels daily or as frequently as we eat, ideally, that's what newborns do, right? They eat, they excrete, eliminate. That's the healthy gut. As long as the stool is formed, that is when the body functions the best possible way. It could be the frequency of the bowel movements, of course, can go down, but usually it has to be at least once a day. So she is not detoxifying. Now she's holding all those toxins inside, and the only thing that helps her is their laxative, herbal laxatives that she's been taking on a regular basis for many, many months now. So at her first visit, she undergoes through the very thorough health history to identify the root cause of her symptoms and her deterioration of her autoimmune conditions. We ordered some tests, not just blood tests, to evaluate her thyroid a little bit deeper. We're not just looking at her thyroid stimulating hormone that was actually elevated in spite of the fact that she's taking thyroid medications, but we also look at their antibodies against the thyroid. Those are thyroid peroxidase and the anti-thyroglobulin antibodies. And her TPO antibodies were elevated, indicating that she has autoimmune condition where her own immune system is damaging her thyroid. So we also ordered some stool tests. The GI map stool test is one of my favorites that I use in the office. And guess what? She had some markers of increased intestinal permeability, or zonulin, that is indicator of leaky gut. She also had some overgrowth of opportunistic bacteria, and as well as their overgrowth of bacteria that are extremely inflammatory, which indicate that she has a dysbiosis. Plus, her beneficial bacteria or keystone bacteria was low, which is also contributing to her dysbiosis. So she definitely has a problem on the gut level. And then we did their food sensitivity, food immune reactivity test, and we found that she is reacting to gluten, wheat, dairy, and corn. So this is actually a very good slide that I want you to understand, because this depicts the epithelial cells. So this is the cell that are coating the lining of our gut. And so there's two epithelial cells that you can see here, and there's a tight junction. It looks like almost a shoelace junction connecting these two cells together. So as long as these shoelaces are tightened up, our gut functions really well. But under certain condition, this tight junction is broken, and that's when we experience leaky gut. And by the way, this zonulin, this is a very important protein that is being broken down anytime we are exposed to gluten. All of us, regardless if we have other problems or not, but anytime we eat gluten, we actually break down this tight connections, tight junctions between the cells, and we predispose ourselves to leaky gut. So this is where I want you to understand what a complex structure is between our epithelial cells of the gut lining. So once we are developing autoimmunity, we actually now identify 3 risk factors that people have. Those risk factors, they're much more predisposed to food sensitivities and autoimmunity, and therefore if we know about those risk factors, we need to really take care of them so our risk of autoimmunity is not developing so quickly. So first of all, genetic predisposition is there, and we usually test people for some of their genetic predisposed diseases like celiac disease. Also, their second risk factor is, of course, the gut barrier dysfunction, that leaky gut, and we can test it with their stool test. And of course, there's some environmental triggers like infections or environmental factors like toxins can contribute to development of autoimmunity. And this is their talking about their gut barrier dysfunction or leaky gut that I already said enough. Many of my patients probably know this schematic representation of leaky gut that explains what leaky gut is. And it's a condition where intestinal barrier, the healthy intestinal barrier that you can see here on the left, where their mucosal membrane cells are tightly connected to each other, and our nutrients are going through a specific pathways between those cells. But in case of their leaky gut, and due to the inflammation, these tight junctions are broken, and now their stuff, the molecules or the food particles and the microbes that are present in our gastrointestinal lumen start leaking into our bloodstream, irritating and stimulating our immune system, that start developing antibodies against those, and that those antibodies will create the negative food reactions, most commonly to gluten, dairy, and soy. It will create a compromised immune system. That's when we develop allergies, asthma, eczema, and we develop nutritional deficiencies because now our gut is not doing the job properly by absorbing those nutrients, but also because we need much more of those nutrients to repair this leaky gut. So if we have enough nutrients, we actually can repair the leaky gut, but if we don't, due to their malabsorption, we actually stay in this state of the gut inflammation and gut intestinal permeability. So, and as a result, that will increase the risk of autoimmune disorders like Hashimoto, multiple sclerosis, rheumatoid arthritis, inflammatory bowel disease, variety of the connective tissue disease, like lupus and others. So this is what how important our gut for our immune system, and specifically in the development of autoimmunity. So now, what is the relationship between food sensitivities and autoimmunities? So the mechanism of leaky gut, obviously, that causes food sensitivity is also a very common factor in the development of autoimmunity, as I said. And as your body is exposed to multiple organisms and food proteins, the antibodies to those food particles, as well as to the microorganisms, can react with your own tissue. And this is a diagram that shows really well that, for example, if you eat gluten, this yellow particles that are depicted in the gut level, right? If they go through their epithelium or our gut lining, and they stimulate our immune cells will create these antibodies, these Y-shaped antibodies to gluten. But guess what? The same antibodies can react with your own thyroid tissue, causing the destruction of the tissue. So this cross-reactivity between antigen, in this case gluten, and the tissue like thyroid, called molecular mimicry, that we can experience through the food sensitivity. And that's the essence of autoimmunity. So the problem with the testing exists that when we test people initially, before they did any treatment, many of us will have tons of food sensitivity. And so those are very, very common. And the recommendations are usually, well, stay away from the foods that you're sensitive to. But sometimes people forget that Beside the avoidance of the foods, we also need to take care of the gut permeability and heal it. Because without it, if we just eliminate the food and continue to eat other food, we will create their sensitivity to other foods as well. So how do we deal with that? So we always treat the leaky gut along with their removal of the foods that we're sensitive to. And I always teach my patients, and my health coaches are teaching our clients, that we need to rotate our food. It's extremely important not to eat the same food over and over. And we are all creatures of habit. We like to eat our oatmeal and we eat it 7 days a week and we think it's the best thing. But it's not. Because if you eat the same thing over and over, you have a higher chance to develop that food sensitivity. Plus, you expose yourself to the same environmental toxins that come with the food inevitably nowadays, right? So either it's pesticides or it's toxic metals or it's some other herbicides and on and on and on. So please make sure you rotate your food. So with their treatment of food sensitivity, we try to identify the contributing factors to the leaky gut. For someone, it could be infections. For someone, it could be just food sensitivity. Some people take medications that cause leaky gut all the time. For example, your Advil or your Motrin, those anti-inflammatory medications that we pop in like there's like a vitamin. Unfortunately, they do cause a lot of leaky gut. Stress is inevitably causing a lot of food sensitivity, leaky gut. So we are encouraging our patients to attend some stress management techniques that we teach our patients. For example, heart math, the biofeedback technique that is great to keep the stress at their manageable level and increase our resilience to stress. And of course, the diet. Majority of the people who come to us have suboptimal diet and they eat a lot of processed food, contaminated food with the preservatives, with the coloring, with their all those artificial things that unfortunately participate in stimulating the leaky gut. So addressing the causes and can repair the intestinal barriers and prevent further food sensitivities. And that's what we try to promote in our patients. And here's a quick list of inflammatory foods and possibly allergenic foods that cause problems in our patients, and the list of the anti-inflammatory food that we usually ask people to focus on. Eating more organic vegetables, organic fruit, raw seeds, organic herbs and spices, using good, healthy, clean oil, extra virgin olive oil or unrefined coconut oil, and staying away from things like wheat products, milk products, peanuts, some tree nuts, soy, eggs, shellfish, and some fish. Doesn't mean that you have to stop eating those forever, but we're asking maybe to eliminate it for some time while gut is healing. Okay, so for my patient who presented with worsening symptoms, in spite of the fact that she was taking thyroid medication, what we prescribed for her as the method of conquering her leaky gut is their probiotics, glutamine, and also very interesting product that we've been getting a lot of success. It's called serum-derived bovine immunoglobulins, which is basically borrowed immunity from their bovine blood. We basically take that. The manufacturer of this product is taking the bovine blood and preparing immunoglobulins or antibodies that you take in the form of the powder with your meals, and they are blanching and binding the variety of the pathogens and the toxins in the gastrointestinal lumen and removing it, reducing therefore the immune burden on our gut lining and our immune system. So great product to be used at any age, especially if you're stressed, if you're sick, post-operatively, or in the process of healing leaky gut. And recently, we also started utilizing more and more technique to build the protective layer of mucin on their gastrointestinal lining that will protect the gut from being exposed to harmful factors that can create inflammation and increase intestinal permeability. We we put usually people on elimination diet at least for 6 weeks, but overall we recommend the Mediterranean diet without dairy, gluten, and corn for people to heal their gut and prevent worsening of their food sensitivities. And of course, there's some additional supplements like we can't live without like omega-3, vitamin D, vitamin K. Interestingly, vitamin D has been shown to tighten those gap junction between the endothelial cells and create a stronger gastrointestinal barrier while soothing the tissue of the gastrointestinal tract. And of course, turmeric, one of the most powerful anti-inflammatory spice that you can utilize in your cooking on a daily basis with a little bit of ginger or pepper. And that is so anti-inflammatory and great for balancing your microbiome diversity. So back to our clinical case of Regina. After 4 weeks, she actually said that her constipation has resolved. And after 4 months, we noticed that her thyroid antibodies improved and her TSH is improved as well. So she reports having much more daily energy. She doesn't have that crash in the afternoon anymore. And her skin improved and her hair stopped falling out and her sleep improved. This is actually very common when we see patients being on elimination diet. They report all those symptoms because they remove this very powerful inflammatory component that comes from the food. Because if we eat inflammatory food and we send that very powerful message 3-4 times a day, imagine how much burden our immune system has to handle. So of course we're going to feel tired. Of course we're going to start having some issues. But when we remove those inflammatory food, people feel significantly better. So that's why we proposed this Immune Foundation program that starts with the evaluation of our patients. People will fill out this questionnaire. We'll go through their history and timeline. When did they start experiencing the symptoms? What are the contributing or triggering factors? Sometimes it comes up right just at the initial visit. We order some tests, usually blood tests and maybe stool tests. We recommend some supplements to probably heal leaky gut or support the nutritional foundation for our patients. And of course, the lifestyle intervention. That's probably the most important thing that people need to do. And we have an army of their health coaching, and we provide a lot of support for our patients on individual basis with health coaches, as well as on the monthly health coaches, health coaching group support. So if you're new to our practice, what would be the next step? I'll invite you to take this Immune Foundation questionnaire to understand what is your underlying trigger to food sensitivity or medical illnesses. Go ahead and watch the YouTube video about leaky gut and about food sensitivities that you can find on my website or in the YouTube. And if you want, schedule the discovery call with my team so you can understand a little better what is the process we want you to go through to understand your health better and bring yourself closer to optimal health. And so with that, I just wanted to quickly open the floor to questions. I see we have a lot of people today. This is great. And I'm going to start with their questions that are written on their meeting chat box. So can you help with endometriosis? Of course. So endometriosis is the hormonal imbalance that definitely is related to gut health. And sometimes it's a very easy fix. Sometimes we need to work a little bit harder to evaluate the reasons. But just briefly, endometriosis is very strongly related to the yeast overgrowth. So definitely we will look at the gut health and the hormonal health to resolve that and stabilize this condition. If one has a leaky gut, does it lead to leaky brain? Thank you, Gali, for their question. Yes, very commonly, people with the mental health issues will present with a leaky gut. So that's why we start with the healing and addressing the leaky gut syndrome to help people to heal their gut, to heal their brain. So there's a very well-established data since 2009. It was written in the Journal of Gastroenterology that the gut-brain connection or axis, GBA we call it, right? Gut-brain axis is very well established, and the gut can influence the brain, and vice versa. Brain can influence the gut permeability. So we'll think about stress, right? Stress will increase their gut permeability, so and vice versa. So indeed, we actually now in the era of the psychoprobiotics. So we are treating their mental health condition with the probiotics that has been positively affecting their mental health outcomes. So yes, indeed, food sensitivity has a lot to do with the leaky brain and mental health. What if you cannot even eat organic, healthy food? Well, yes, we do have patients who have such a severe gut permeability and food sensitivity that they have a hard time to eat even organic foods, right? So this is extreme case. In these cases, we sometimes utilize elemental diet with simple protein or even amino acids to feed and heal the gut lining. And we utilize a variety of the things that I already mentioned. So yes, so it might be extreme cases. Usually we need to identify the reasons for that severe sensitivity. Dysbiosis either with parasites or with bacteria or viruses could be one of the reasons for that, and that's why a good proper evaluation would be very essential for that. So here's another question. I've tried all this, had every test, and keep losing weight. Still no diagnosis. Don't see how any of this will help me. Eleanor, it's hard for me to tell. Every patient is very different, and yes, some patients are very resistant to treatment, not because they want to, but because they can't help it. There's a lot of, we're doing more and more evaluation of patients' emotional components to their healing. So every new patient now in my practice is being evaluated for their neuro-emotional complexes that we form based on our life experiences and based on the emotional trauma that we experience, because those can be barriers for healing. And we like to address those right at the front of our communication with patients, because that might be the reason. Or it might be just some other factors that are not accounted in their conventional tests. So it's hard for me to tell exactly, Leonore, what's going on in your case, but I would still start with a very detailed history and timeline of your symptoms development. Can one take the bovine serum if not able to do cow foods? Absolutely. So you mean cow milk? It's not. It's a dairy-free because it's made from the bovine serum. So I have patients with the alpha-gal allergy, which is the allergy to their beef, and they're able to tolerate that because all it is their filtered antibody immunoglobulins from the bovine serum. So that's usually they tolerate it really well. But people who cannot tolerate bovine or afraid to tolerate to try it, we actually have a similar product based on the egg, on their chicken eggs product. So those are the chickens that are stimulated with a variety of their antigens, and they produce immunoglobulins in their egg protein. So we do have some options for those patients. I read somewhere that it's helpful to change up your probiotics every once in a while since your body can get used to them. Is this factual? Yes. Well, first of all, we know that anytime you take probiotics, they live in your gut only for a short period of time. They do not colonize your gut forever. So they stay there for an average is 2 weeks. And then it's great to enhance the biodiversity. So the variances of the probiotics in your gut. So I do like to rotate the probiotics. We're now working more and more with our spore probiotics. So that's usually a great option for patients. We are now really utilizing probiotic based on their clinical need. So, for example, some patients with their, for example, sleep problem benefit from sleep enhancing probiotics, believe it or not, right? People with who have a very labile immune nervous system and have a low resilience to stress will benefit from other probiotics. So it's a psychobiotics that I mentioned. So yes, and there are some probiotics just to enhance their mucin level on the gut lining and improve the intestinal permeability. So it's a great idea to rotate your probiotics, but work with your practitioners, Haley, to find what is the probiotic best for you in your case and in your presentation. I have a high ANA, and my doc said there's nothing can be done. Well, that's the very problematic approach in conventional medicine. And that's their it's not true. ANA is actually indicator of some autoimmune process or some inflammation and the tissue destruction that is going on. So it's very important to find out what is the reason for that and address it. And I see in multiple cases of my patients when ANA will convert to negative. A lot of times I see a lot of people will have an ANA positive after certain vaccinations. That's one of the mechanisms. So a detailed history take, Gladys, will help us to determine what is your reason for that ANA, and addressing it will stop the progression of the autoimmune disease. So there's much can be done, and that's the difference where functional medicine can help you a lot. And conventional medicine, unfortunately, yet has that knowledge and training. So a lot of conventional doctors who are interested in this subject will go and learn on their own, but it's not part of the conventional training yet. That's why people who are kind of stuck in the conventional mindset think that there's nothing to be done. There's a lot to be done. We're talking about it now. Okay, so great. Haley, I'm glad that you are joining the practice and you're seeing my physician assistant, Marina, who's been trained with me for more than a year. And every case who Marina sees, we actually discuss afterwards. So I know all the patients, and I kind of put my experience and my understanding of the case. So when you see my physician assistant, you actually see me as well, maybe not directly, but it's a great benefit to see her. And Marina, by the way, is a certified functional medicine practitioner at this point. So she is a great resource. So we look forward to seeing you. Do you use vitamin minerals testing? Is that helpful to identify problems? I've had low ferritin and low iron absorption, but not anemia since young age. Also, do you use ultra labs to help with special testing cost? Thank you. No, unfortunately, I don't know about ultra labs, but the prescription that we give you at the end of our evaluation can be taken to any lab. So you can take it to Ultra Lab, Quest Lab, Empire Lab, LabCorp, any lab that is you find to be cost efficient and that is covered by your insurance. So we definitely you can take it to any lab. So do we do the vitamins and mineral testing? Yes. So we can do it through their micronutrients evaluation. We usually utilize the lab vibrancy lab. they give us a really good information, not just about intracellular levels of their, extracellular levels of the nutrients, meaning in the bloodstream, but also what is inside of the cells, which is much more informative and indicating your storage of the nutrients. How much do you have in the storage? Because what's in the bloodstream, body will do anything possible to keep their vascular levels in the optimal state, right? That's to support the homeostasis. But what is actually going on in the intracellular level will show you a true resources, the true indicator of nutritional status in your reservoirs. It's like I'm making an analogy with your banking, your safety deposit bank, right, in your bank and in your pocket. So the cash that you have in your pocket will help you to sustain yourself in a daily basis, right? Today, maybe tomorrow. But what's in your safety account, saving account, will help you to sustain some stressors. So that's the same thing with their nutritional testing. So I like to see what my patients have inside in the intracellular level, because then I know how resilient they are. Does it make sense? Yeah. So we do test nutritional status because it's very important. Nutritional status is one of those foundations how people can heal, right? Because if we provide enough nutrients to our body, we can heal the leaky gut much faster. Even if we have a perpetual risk factors like dysbiosis or food sensitivities, if body has the building blocks, it can heal itself quicker. So that's why we really like to see what's going on in their nutritional status. Okay. Well, that was a really great questions. Thank you so much. If you have any other questions, feel free to unmute and ask me in person. Otherwise, I will see you all next time at our next live Q&A that will take place next month. Keep an eye on our announcements. And I just want to give you a few more announcements about what else is coming up in our practice. Let me show you. We do have upcoming 3x4 support group. This is a group of the patients. We're gathering our patients who had genetic testing. For those of you who are my patients already, I see a lot of you there, and who had the 3x4 genetic testing. We will have a 1-hour discussion with our expert, Regina, Kucher, our physician assistant. She will be discussing your specific test or maybe questions about your specific test. So if you're interested, please sign up and send your questions in advance. This is a great test to know your vulnerabilities, and it can answer the questions like, why do you have a difficulty to lose weight? Or what is the status of your heart health? Or do you have a predisposition to diabetes or sugar dysregulations? How's your brain health in the future? All those things can be answered by this test. So excellent test to know what to look for and what to capitalize on your advantages and disadvantages from the genetic standpoint. I also would like to mention that we have this amazing treatment modality that we offer to our patients, which utilizes the electromagnetic frequencies. So pulse electromagnetic frequency therapy with the Ondamed. This is a German technology of more than 30 years old, and we've been using a lot of it to identify the reason for tissue dysfunction and treating it right on the spot with the frequencies, so with the specific vibrations. So great for treating the tissue, helping tissue to release the toxins and improve detoxification, improve their nutrients status. For for their question earlier on the iron deficiency, sometimes there's a missing link. Something is not clicking. Why their iron is deficient in spite of their anemia is not there, which is great. But nutritional status will be addressed by this technology. it reduces the inflammation, it helps their cellular repair and regeneration, helps with their blood circulation, and from their symptom standpoint, it actually helps with the pain reduction, stress reduction, improves vitality, improves patients' tolerance to EMF, electromagnetic field, that we are bombarded with the Wi-Fi and all the 5G that is going on around us. So all of that can be mitigated by the on-demand treatment. And as a thank you for joining us today, please go to my e-commerce store, which is shop.drlenaklemenko.com. You can see it here, and get 10% off on all the products that you can find in the store by using that code MARQA10. So it's for March. So throughout the March, you can use this code if you need to order any of the products. So with that, I want to relieve everybody and wish everyone a great weekend. The weather in New York is beautiful, and it looks like their spring is already coming for good. And let's enjoy every minute of it.
I think we're going to have a snowstorm in a couple of weeks, 10 feet.
Oh, you're in Tennessee, Jeff.
I'm in New York.
Oh, you're in New York, but Tennessee is too far for us. So we're just going to enjoy this weekend.
Yeah, I learned a lot. I'm going to go on your YouTube. I have the link.
Oh, great. Great.
Yeah.
And give us a call if you have any questions.
And the next seminar is in a couple of weeks, right?
Right. We're going to have one seminar in April because of their slur of the holidays, their Passover, the Easter, Orthodox Easter, Ramadan, everything is in April. So we decided to do only one session in April. I think it's going to be April 24th. It's going to be about gut health as well. So keep an eye on our announcements. And
I had it written down here that it was going to be on April 7th. No, it's not going to be on April 7th.
I think we canceled that. Yeah, so I think it's going to be on April 24th.
You sure it's not the 20, April 24th? That's a Monday. Monday?
Well, then it's, I don't remember exactly the day, but we'll definitely announce it. I think it's April, looking at the calendar.
Yeah, I had it written as April 21st, but I don't.
Let me see.
Yeah, because I want to attend.
Yeah, it could be April 21st. But keep an eye on the announcements because there might be some changes in the schedule. It might be as well on April 7th.
It might be. All right, I'll call up.
Yes, we're still working on the dates.
All right, I'll check. I'll call up.
Yeah, stay in touch.
Thanks.
All right, thank you so much, everyone. Have a terrific weekend.
Question?
Yeah.
Can I ask you a question before you leave?
Yes.
I really wanted to attend the genetic testing this Monday, but unfortunately I have I have a conflict. I have a class for work, so I can't attend. Will you be offering that again another time, or?
Yes, we actually have it on a monthly basis. It's mostly geared towards people who already had the test and want to dive deeper and answer questions, get the answers. And it's a very efficient way to do it in the group because, it's definitely, you have a whole hour and you can learn from other people, and some patients have similar pathways that need to be discussed. So Marina will be presenting it.
Okay, and I have taken a pretty extensive genetic test through a different doctor, but I would just like to learn more. Would that be okay to go with, or?
Yeah, you might benefit from it, especially if you have, if there will be questions about specific single nucleotide polymorphism, SNPs we call it. So you might get benefits from it as well. Yeah.
Okay.
But it will be geared towards the format that 3x4 presents, which is pathway formats, not so much single gene and clinical outcome. But there will be some benefits for people who just want to discuss a single genetic SNP.
Okay. I don't know what all that means, but I know I had 232 pages worth of testing done, so I
Wow,
have no
that's
idea.
pretty intense.
Yeah, so I just wanted to see if maybe I might be able to learn a little bit more than what I already know.
You might, if you have a specific question about specific thing, specific gene, Marina might be able to address it for you.
Okay,
But it's more geared towards people who already had the test and
okay,
want to get
okay.
it.
Well, then that's good to know. I'll stay tuned for when you have it again then.
Yeah,
Thank you.
we have it monthly because
Okay,
there's
that's
more
good
and
to
more
know.
people who went through the test and had a one-on-one consultation, but still have some questions. And that's a really cost-efficient way to provide the care for our patients.
Okay, well, that's good to know. I'll take a look at your test too. So thank you.
Yeah. All right. Well, thank you
Thank you.
very much, everyone. Have a great weekend. Bye-bye.